Welcome to Blood Sugar Squad, your go-to channel for simple, actionable tips to manage diabetes and live your best life. If you have type 2 diabetes, you have probably heard a lot of drug names: Metformin, Jardiance, Ozempic, Januvia. Insulin. It can feel overwhelming. What do these drugs actually do? Why would a doctor choose one over another? And why do some people take multiple medications while others take only one? Here is the truth. Diabetes medications work in very different ways. Some help your pancreas release more insulin. Some slow down digestion. Some help your kidneys flush out extra sugar. And some help your cells respond better to the insulin you already make. Two people with the exact same A1C may leave their doctor's office with completely different prescriptions. In this video, we are going to break down every major class of diabetes medication. We will explain how each one works, who it is for, the most common side effects, and why your doctor might choose one over another. By the end, you will understand the full landscape of diabetes medications and be better prepared to talk to your doctor about your own treatment plan. Segment 1. The Big Picture. Before we dive into specific drugs, let us understand the big picture. Diabetes medications generally fall into three main categories. First, oral medications. These are pills you take by mouth. They are often the starting point for treating type 2 diabetes. Most oral medications work by helping your body make more insulin, use insulin more effectively, reduce sugar production, slow sugar absorption, or remove excess glucose from the body. Second, non-insulin injectable medications. These are shots you take, but they are not insulin. Most are GLP-1 receptor agonists, which mimic a natural hormone in your body to lower blood sugar, slow digestion, and help you feel full. Third, insulin. Insulin is a hormone your body naturally produces. When your body does not make enough insulin, or when other medications are not enough, you may need to take manufactured insulin. It is the most powerful medication for lowering blood sugar. Now let us walk through each category, one class at a time. Segment 2. Oral medications. Let us start with the one that is almost always the first choice: Metformin. Metformin belongs to a class called biguanides. It has been around for decades and remains the most commonly prescribed diabetes medication in the world. Here is how it works. Metformin reduces the amount of glucose your liver releases into your bloodstream. It also helps your cells respond better to insulin. Metformin is effective, affordable, and does not usually cause weight gain. In fact, many people lose a small amount of weight while taking it. It also does not typically cause low blood sugar when taken by itself. Many people worry when they start metformin because of stomach side effects. The good news is that nausea, diarrhea, and stomach upset often improve after a few weeks, especially if you take the medication with food or start with a lower dose. If you have significant kidney problems, your doctor may adjust your dose or recommend a different medication. Now let us talk about a class that works very differently: Sulfonylureas. These include Glipizide, Glyburide, and Glimepiride. You can think of sulfonylureas as forcing the pancreas to work harder. They stimulate your pancreas to release more insulin, regardless of your blood sugar level. They have been around for a long time and are inexpensive, which makes them attractive when cost is a concern. But they come with two major downsides: weight gain and low blood sugar. Because they stimulate insulin release even when blood sugar is not especially high, they can cause hypoglycemia, particularly if you miss a meal. For many people, newer medications are often preferred, but sulfonylureas remain a practical option for millions of people around the world. Now let us talk about one of the hottest classes in diabetes treatment right now: SGLT2 inhibitors. This class includes Jardiance, Farxiga, and Invokana. These medications work in the kidneys. Normally, your kidneys reabsorb glucose back into your bloodstream. SGLT2 inhibitors block that process, so excess glucose is flushed out through your urine. That extra glucose pulls water with it, which is why increased urination is a common side effect when starting an SGLT2 inhibitor. These drugs lower blood sugar, may help with modest weight loss, and can lower blood pressure. Even more importantly, they have been shown to protect the heart and kidneys in certain patients. Common side effects include urinary tract infections and yeast infections. DPP-4 inhibitors are another class. These include Januvia, Tradjenta, and Onglyza. They work by blocking an enzyme that breaks down a natural hormone called GLP-1. By preserving GLP-1, these medications help your body release more insulin when blood sugar is rising and reduce the amount of glucose your liver releases. They are weight neutral and generally do not cause low blood sugar on their own. Side effects can include headache and upper respiratory infections. GLP-1 receptor agonists are also available in pill form. Semaglutide, sold as Rybelsus, is currently the only oral GLP-1 medication. It works similarly to the injectable versions, which we will discuss in a moment. Thiazolidinediones, or TZDs, include Pioglitazone and Rosiglitazone. Pioglitazone is by far the most commonly used medication in this class today. These drugs improve your cell's sensitivity to insulin. They are effective, but they are not used as often anymore because they can cause weight gain and fluid retention. They may also increase the risk of heart failure in some people and should be avoided if you have certain heart or liver conditions. Meglitinides, like Repaglinide and Nateglinide, work similarly to Sulfonylureas by stimulating insulin release from the pancreas. They are short-acting and taken before meals. They also carry a risk of low blood sugar and weight gain, and they are less commonly prescribed today. Alpha-glucosidase inhibitors, such as Acarbose and Miglitol, slow the breakdown of starches and sugars in your intestine. This helps reduce blood sugar spikes after meals. The downside is that they often cause gas, bloating, and diarrhea. Bile acid sequestrants like Colcivelum are primarily cholesterol-lowering medications that also have a modest effect on blood sugar. Finally, there are a few less commonly used medications, such as bromocriptine, but these drugs play only a small role in diabetes treatment today. Segment 3. Non-insulin injectable medications. Now let us talk about injectable medications that are not insulin. The most important class here is GLP-1 receptor agonists. GLP-1 is a natural hormone your body releases after you eat. It helps lower blood sugar, slows digestion, and signals your brain that you are full. GLP-1 receptor agonists mimic this hormone. These drugs stimulate your pancreas to release insulin only when blood sugar is rising. They also slow how quickly food leaves your stomach, which helps reduce blood sugar spikes after meals. And because they reduce appetite, many people lose weight while taking them. Common GLP-1 receptor agonists include Ozempic, Trulicity, and Victoza. Semaglutide, the active ingredient in Ozempic and Wegovy, is one of the most well-known. Mounjaro works a little differently. It is a dual GEP and GLP-1 receptor agonist, meaning it targets two natural hormones instead of one. Because these medications can significantly lower blood sugar and often lead to substantial weight loss, many experts consider them game changers in diabetes treatment. The most common side effects are nausea, vomiting, and diarrhea, especially when you first start or when the dose is increased. In rare cases, they have been linked to pancreatitis. GLP-1 receptor agonists are usually taken once a week, although some are taken daily. Because they lower blood sugar without a high risk of hypoglycemia and often promote weight loss, they have become extremely popular in recent years. Segment 4. Insulin. Insulin is the most powerful medication for lowering blood sugar. It is a hormone your body naturally produces to help glucose enter your cells for energy. If you have type 1 diabetes, your body does not make insulin at all, so you must take it to survive. Many people with type 2 diabetes also eventually need insulin, especially as diabetes progresses over time. Some people view starting insulin as a sign that they have failed. That simply is not true. Diabetes changes over time, and needing insulin is often just a natural progression of the disease. Insulin comes in several forms. They are classified by how quickly they start working and how long they last. Rapid-acting insulin starts working within about 5 to 15 minutes and lasts roughly 3 to 5 hours. It is typically taken before meals to cover the rise in blood sugar from eating. Examples include Lispro, Aspart, and Glulisine. Short-acting, or regular, insulin starts working in about 30 minutes and lasts 6 to 8 hours. It is usually taken about 30 minutes before meals. Common examples include Humulin R and Novolin R. Intermediate-acting insulin, like NPH, starts working in 1 to 2 hours and can last up to about 24 hours. It provides coverage between meals and overnight. Long-acting insulin provides a steady background level of insulin throughout the day and night. Examples include Glargine, Detmir, and Degludec. Many people use a combination of long-acting insulin for background coverage and rapid-acting insulin before meals. This is called a basal bolus regimen, and it closely mimics how the body naturally releases insulin. Insulin is usually injected with a syringe, a pen, or delivered through an insulin pump. There is also an inhaled rapid-acting insulin, although it is less commonly used. The most common side effect of insulin is low blood sugar, or hypoglycemia. Because insulin directly lowers blood sugar, taking too much or not eating enough can cause levels to drop dangerously low. Weight gain is also possible. Segment 5. Why your doctor chooses one over another. The answer is simple. It depends on you. For most people with type 2 diabetes, Metformin is still the first choice. It is effective, safe, and affordable. But after that, the decision depends on many factors. If you have heart disease or kidney disease, an SGLT2 inhibitor or GLP-1 receptor agonist may be preferred because of their proven heart and kidney benefits. If weight loss is a priority, GLP-1 receptor agonists are often chosen because they can help people lose significant amounts of weight. SGLT2 inhibitors can also help with modest weight loss. If you are at high risk of low blood sugar, sulfonylureas and insulin may be avoided when possible because they carry the highest risk of hypoglycemia. Insurance coverage can also influence treatment decisions. Unfortunately, many newer medications can be expensive, and insurance companies do not always cover them. If cost is a major concern, older medications like Metformin and Sulfonylureas are often much less expensive. Some people need a combination of medications, such as Metformin plus a GLP-1 receptor agonist, or Metformin plus an SGLT2 inhibitor. And if you have type 1 diabetes, insulin is not optional. You need it to survive. The most important thing is that your treatment plan fits your health status, your lifestyle, your goals, and your preferences. Your doctor should work with you to choose the best option, and that plan may change over time. Diabetes medications are powerful tools that help manage your blood sugar and protect your heart and kidneys. But no medication works in isolation. What you eat every day matters just as much as what you take. That is why we created the Mindful Eating for Diabetes Guide. It is a free, practical toolkit to help you build a healthier relationship with food. Just use the QR code on screen or the link in the description below. Segment 6. Final thoughts. Diabetes medications work in many different ways. Metformin reduces sugar production in your liver. Sulfonylureas and Meglitinides stimulate your pancreas to release more insulin. SGLT2 inhibitors help your kidneys flush out extra sugar. GLP-1 receptor agonists slow digestion, reduce appetite, and help your body release insulin when needed. DPP-4 inhibitors extend the life of natural hormones that help control blood sugar. Thiazolidinediones improve how your cells respond to insulin, and insulin is the most powerful option for lowering blood sugar, especially when your body does not produce enough of its own. There is no single best medication for everyone. The right choice depends on your blood sugar levels, your other health conditions, your lifestyle, and your goals. Talk to your doctor about your treatment plan, and do not hesitate to ask questions. Have you taken any of these medications? What has your experience been? Comment below, and please share this video with someone who is newly diagnosed with diabetes or someone confused about their diabetes medications. Until next time, stay strong, stay sweet, but not too sweet, and keep thriving with the Blood Sugar Squad.